We are here to announce the results of the largest federal health care fraud takedown in our nation's history. 94 people in 5 cities have been charged for their participation in schemes to submit more than $251 million in false Medicare claims. Here in Miami, 24 defendants have been charged for their alleged involvement in fraud schemes totaling approximately $103 million. Additional arrests are being made as we speak in Baton Rouge, Brooklyn, and Detroit. Those charged today include physicians, they include medical assistants, they include healthcare owners and executives. According to the indictments, these defendants participated in schemes to submit claims to Medicare for treatments that were not medically necessary and oftentimes were never provided. Since March of 2007, when the first phase of the strike force was launched here in South Florida, this initiative has resulted in the indictments of more than 810 organizations and individuals, including those charged today. By improperly billing Medicare for more than $1.85 billion, these criminals have siphoned resources from the most vulnerable among us. With today's arrest, we're putting would-be criminals on notice. Healthcare fraud is no longer a safe bet.
It's harder to submit false claims. If you do, you're more likely to get caught, and when you get caught, you're going to pay a higher price. The arrests we've made this morning are a sign that these efforts are making progress. So today we have the same message for hardworking Americans and scam artists that steal their health care dollars. We are just getting started, and we're taking this effort very seriously. I think the sort of old theory of pay and chase is one that we would like to flip to prevent in the first place. So we're in the process of setting up a data universe where we can monitor real-time billing activities and spot errant billing. We have now in place the tools to stop payments before the money goes out the door, so that if we suspect criminal activity, we actually don't pay the provider. The new Affordable Care Act gives us additional tools, frankly, that we didn't have before. And one of the tools is the kind of boots-on-the-ground activity that the heat strike forces have brought. So we actually have people who can go physically inspect what is suspected to be fraudulent activity, see if behind the biller there really is a provider providing services, or if it's a fake storefront. That effort, combining local enforcement, our Inspector General's office, has really never been in place before. So I think you're absolutely right, but we are gearing up those activities to try and actually get out ahead of the fraud. This is nobody's home. 92, I think we're in business hours. Sure we are. Well, we were taken by one of the special agents to a building which is known for sort of fly-by-night operators. Many of the doors that we found list office hours, but they're locked tight as a drum. He has already been responsible for 9 different arrests of people in this building and prosecuting them, but we think they're probably flipping these offices. So we're just talking today about ways that we could even begin to target some addresses. If we know that this is a notorious address, that maybe some pre-screening at the outset. We're using all the tools we have, looking at the data, finding aberrant billing behavior, pre-screening folks and enhancing the penalty and going after them in the long run.
The intention of the new act and this enforcement effort is to put people in jail who do these kinds of things, to hammer people, so that if you engage in this kind of fraud, it's not simply going to be you're going to pay some money and maybe work your way out of this thing. Our intention is to find people and to put them in jail and to make that a deterrent for people to understand that if you engage in this, if you steal, in essence, from the American people, among the most vital of programs, you will go to jail. That is the message.